Course Learning Outcomes CLO1. Define the terms related to herbal medication and other alternatives health care modalities. CLO2. Discuss RA 8423 or the Traditional Alternative Medicine Act of 1999. CLO3. List down and discuss alternative healthcare modalities as practiced in the Philippines. CLO4. State the importance of herbal preparation. CLO5. Explain the common methods of preparing and administering herbal medicines. CLO6. Enumerate the indications and preparations of the 10 medicinal plants endorsed by Department of Health. CLO7. Cite other herbal plants utilized in other countries as approved by their health agencies. CLO8. Discuss the contraindications in the use of herbal preparation. CLO9. Explain the scientific principles involved in preparing and administering herbal medicines. CLO10. State the guidelines in herbal preparation. CLO11. Cite nursing responsibilities in administering herbal medications. CLO12. Demonstrate beginning skills in herbal preparations. CLO13. Perform herbal preparations with the family in the community using homegrown herbal plants.
Hello everyone, my name is Gwyneth Napoli and I will be reporting to you about CLO number 1, which is to define the terms related to herbal medication and other alternative healthcare modalities. Herbal preparation. This is the therapeutic use of medicinal plants as substitutes for or in combination with pharmaceutical drugs. And this is how plant-based medicine is prepared. Traditional and alternative healthcare. This is the sum total of knowledge, skills, and practices on healthcare other than those embodied in biomedicine, used in the prevention, diagnosis, and elimination of physical or mental disorder, such as in the presentation example is meditation and yoga. Traditional medicine is the sum total of knowledge, skills, and practice on healthcare, not necessarily explicable in the context of modern scientific philosophical framework, but recognized by the people to help maintain and improve their health towards the wholeness of their being, the community and society, and their interrelations based on culture, history, heritage, and consciousness. One example is the Chinese traditional medicine, which is acupuncture, and one most renowned in our country, especially in this time of pandemic, is the herbal steam and smoke, or locally known as tuob. Biomedicine is a theoretical medicine. It is a branch of medical science which studies the human body from theoretical positions. The results of research in biomedicine are modern drugs, deeper understanding of the nature of illness, and more advanced knowledge about the human body. For example, is the aging processes. Alternative healthcare modalities are other forms of non-allopathic, occasionally non-indigenous or imported healing methods, though not necessarily practiced for centuries nor handed down from one generation to another. Some alternative healthcare modalities include reflexology, acupressure, chiropractics, nutritional therapy, and other similar methods. Herbal medicine are plant-based medicine made from differing combination of plant parts, such as leaves, flowers, or roots. Each part can have different medicinal uses, and the many types of chemical constituents require different extraction methods. Both fresh and dried plant matter are used depending on the herb. And lastly, natural products are those foods that grow spontaneously in nature, whether or not they are tended by man. It also refers to foods that have been prepared from grains, vegetables, fruits, nuts, meats, fish, eggs, honey, raw milk, and the like, without the use or addition of additives, preservatives, artificial colors, and flavors, or manufactured chemicals of any sort after harvest.
CLO number 2. Discuss Republic Act 8423 or the Traditional and Alternative Medicine Act of 1999. The overview of the law. To accelerate the development of traditional and alternative healthcare in the Philippines by providing for a traditional and alternative healthcare fund and for other purposes. To improve the quality and delivery of healthcare services to the Filipinos through the development of traditional and alternative healthcare and its integration into the national healthcare delivery system. Its significance. It encourages scientific research on and develop traditional alternative healthcare systems. It promotes and advocates the use of traditional, alternative, preventive, and curative healthcare modalities. It develops and coordinates skilled training courses for various forms of traditional and healthcare modalities. It formulates standards, guidelines, and code of ethical practice appropriate for the practice of traditional and alternative healthcare. It formulates policies for the protection of indigenous and natural health resources and technology. It formulates policies to strengthen the role of traditional and alternative healthcare delivery system. And lastly, it promotes traditional and alternative healthcare in a wide variety of units and agencies. CLO 3. Discuss and list down alternative healthcare modalities as practiced in the Philippines. First is acupuncture. Acupuncture is a form of treatment that involves inserting very thin needles through a person's skin at specific points on the body to various depths. Its advantages are: it is safe when performed correctly. There are very few side effects. It can be effective combined with other treatments. It can control some types of pain. And it may help patients for whom pain medications are not suitable. Downsides are: it is dangerous if a patient has bleeding disorder or takes blood thinners. Bleeding, bruising, and soreness may occur. Unsterilized needles may infect the patient. In rare cases, a needle may break and damage internal organs. When inserted deeply into the chest or upper back, there is a risk of collapsed lung, although it is very rare. Moxibustion. Moxibustion is a type of traditional Chinese medicine. It involves burning moxa, a cone or stick made of ground mugwort leaves, on or near your body's meridians and acupuncture points. Advantages are: it alleviates pain due to injury or arthritis, helps in digestive problems and irregular elimination, and lastly, protection against cold and flu strains. Downsides are: allergic reactions, sore throat or coughing from smoke, nausea and vomiting, and dark patches of skin. Third is cupping therapy. So, cupping therapy, it involves placing cups on the skin to create suction. The suction may facilitate healing with the blood flow. Cupping increases the blood circulation to the area where the cups are placed. Advantages are: it may relieve muscle tension, which can improve overall blood flow and promote cell repair. It may also help form new connective tissues, create new blood vessels. The practice is possibly effective at treating digestive issues, skin issues, and other conditions commonly treated with acupressure. Downsides are: scarring of the skin may occur, infection is always at risk, and hematoma may occur. Next is neuropathy. It is a system that uses natural remedies to help the body heal itself. It embraces many therapies including herbs, massage, acupuncture, exercise, and nutritional counseling. Upsides are it is accessible to all individuals, it may ease the side effects of chemotherapy, and it is a good alternative medicine. Its downsides are your practitioner may apply pressure to your spine. This can cause damaged arteries, nerve, bones, and spinal discs. Possible allergic reactions. This involves cutting out certain foods or fasting. That means going for periods without eating. This can be dangerous for people with diabetes. Lastly, homeopathy. It is a basic belief behind homeopathy is quote-unquote like cures like. In other words, something that brings on symptoms in a healthy person can, in a very small dose, treat an illness with similar symptoms. This is meant to trigger the body's natural defenses. Upsides are placebo effect may trigger the brain to release chemicals that may ease the pain or symptoms, and it can be used for a wide variety of health issues. Downsides are it can contain large amounts of active ingredient like heavy metal, which can be dangerous. And using teething tablets and gels may cause possible health risks to infants and children.
Hello everyone, I am Gerat Marian Jean and I am tasked to discuss CLO number 4, which is to state the importance of herbal preparations, and CLO number 5, which is to explain the common methods of preparing and administering herbal medicines. If you have any questions, please raise it after our group's discussion. To make it shorter and easier to understand, I came up with 5 importance of herbal preparations. First, it is affordable. Second, more closely corresponds to the patient's etiology. Third, play a vital role against cancer disease. Fourth, satisfies a desire for more personalized healthcare. And lastly, health promotion and therapy for chronic as opposed to life-threatening conditions. Next, we have the 6 common methods of preparing and administering herbal medicines. First, we have decoction. It can be defined as a strategy utilized for the extraction of harsh materials like roots and barks. There is a minor difference from the common infusion process, which is the constant supplement of heat to keep the finely partitioned herb saturated in boiling water. The mixture is left simmering slowly as opposed to strong boiling. For the compensation of losses that may come from the evaporation, water is added to the mixture. On cooling, decoction is filtered, then the herb is removed. Basically, steps of making a decoction are very similar to brewing a cup of tea. Plant cells are swelled as a result of the effects of heat and moisture. The cell wall is extended and then plant constituents are hydrodispersed from the swollen membranes. Here we have the advantages and disadvantages of decoction. Under advantages, we have easily absorbed by the patient after drinking into the stomach. Result is much quicker than other formulation and can give a patient an individual treatment. Under disadvantages, we have it requires a long preparation time. Patient needs to spend some time boiling the herbs every day and usually quite bitter. The second common method is named as elixir. In modern times, the word elixir refers to a medicinal concoction or a sweetened liquid usually containing some form of alcohol that is used in medication as a flavoring or for its medicinal compounds. A basic elixir is similar to a tincture but with the addition of a sweetener. In herbal medicine, most often used is honey. Many elixir recipes also add water, like distilled water, to do a bit of dilution to the mix. The honey can often act as a stabilizer in your elixir and can sweeten things up a bit. These are the advantages and disadvantages of elixir. Under advantages, we have insoluble drug compounds can be incorporated into the hydroalcoholic vehicle. Drug concentrates can be prepared in high alcohol containing elixirs. Hydroalcoholic vehicles can be self-preserving, less viscous, and contain a lower proportion of sugar. Under disadvantages, we have it cannot be administered to pediatric patients and patients on antidepressant medication. The concentration of active and inactive ingredients may vary if not preserved in cool places. Water-insoluble drug compounds may precipitate due to alcohol evaporation. Third common method is what we call infusion. Herbal infusions offer an easy method for consuming the oils and flavors from favorite herbs. Infusion is a process of steeping or soaking herbs in water until the water absorbs the oils and flavors, then drinking the liquid for the taste or for the medicinal value. Herbal tea is a form of infusion in that it is created by steeping herb leaves in hot water, but the resulting drink is rather weak since the steeping period is usually fairly short. True infusions typically use roots, shoots, leaves, and flowers of the plant, while teas typically use only the leaves in the steeping process. And true infusions require a considerably longer period of steeping. Herbal tea can be thought of as weak infusion, while true infusions are sometimes called long infusions to distinguish them from teas. Advantages and disadvantages of infusion. Under advantages, it offers a more natural way to ingest herbs when compared to swallowing pills and tablets. A way to enjoy the taste of various herbs, easy to make, and it is a process that requires time but minimal effort. Under disadvantages, the common side effects of herbal infusions are headache, flushing of skin, soreness in mouth, heartburn, nausea, dizziness, and hormonal imbalance. The fourth common method is oil. Herbal oils are vegetable extracts in which the solvent is always a vegetable oil. Herbal oils have been prepared since antiquity. They are as well used for external applications as dietary products. Herbal oils, also called oil extracts, are traditional herbal remedies used to treat several conditions. Beneficial effects are achieved through the combination of nutrients, antioxidants, and biostimulants obtained from herbs using gentle, non-destructive oil extraction techniques. Therefore, all knowledge of healing effects of herbal oil acquired over the centuries of trials and mistakes are applicable only to oil extracts until proven otherwise. Here are the advantages and disadvantages of oils. Under advantages, we have moisturizes your scalp. Oiling your scalp is a great way to add useful vitamins, minerals, and fatty acids to your hair, encouraging growth, maintaining skin moisture. Massaging oil on your scalp helps to stimulate blood circulation and contributes to relaxing the body. Under disadvantages, we have sticky and greasy feeling. Too much of oil can give your hair an overly shiny or dirty look. When you allow oil to soak in your scalp, it can cause infections. And lastly, it may cause skin irritation to some people. The fifth common method is syrup. A herbal syrup is prepared by combining a concentrated decoction with either honey or sugar and sometimes alcohol. The base of such a syrup is a strong herbal decoction. Mixing a decoction with honey or sugar helps to thicken and preserve the decoction. This increases the shelf life of the decoction and often creates a soothing application that benefits situations such as sore throat, cough, dry irritated tissues, and digestive issues. The added sweetener can also help to increase the palatability of some herbs. Many folks, including children, find syrups to be delicious. Herbal syrups make a yummy addition to beverages and food, and combined with a spoonful or 2 tablespoons of syrup with carbonated water to create a tasty and healthful herbal soda. You can also make a quick cup of tea by adding a spoonful of syrup to hot water. Enjoy your syrup by drizzling it on foods like yogurt, oatmeal, biscuits, and ice cream, or just enjoy by the spoonful. Here we have the disadvantages and disadvantages of syrup. Under advantages, we have all natural syrups contain certain herbs such as calendula, astragalus, andrographis, and medicinal mushrooms, to name a few, that can help boost the immune system, improving your body's ability to combat the common cold and flu. Under disadvantages, we have the sugar molecules inside the syrup can be crystallized. It has a risk on dental caries and not suitable for diabetic patients. The last common method of preparing and administering herbal medicines is what we call tincture. Tinctures are concentrated herbal extracts made by soaking the bark, berries, leaves, either dried or fresh, or roots from one or more plants in alcohol or vinegar. The alcohol or vinegar pulls out the active ingredients in the plant parts, concentrating them as a liquid. Tinctures make it easy to consume the natural, health-boosting chemicals found in some plants. They're usually inexpensive to make and can be easily prepared at home. The accessibility of herbal remedies like tinctures is probably a major reason why an estimated 80% of the world's population relies on these treatments for at least some of their healthcare needs. Using tinctures and other herbal remedies isn't without risk. Even the plants scientifically proven to benefit health come with risk of side effects, some of which are serious. Here are the advantages and disadvantages of tinctures. Under advantages, it often allows more constituents to be released, making them very potent, easily absorbed, long shelf life, and more concentrated than a tea. 30 drops of an extract is roughly equivalent to 1 cup of tea. Under the disadvantages is the alcoholic content. There are only about 15 drops of alcohol per cup, which can be evaporated off if necessary by placing the extract in a cup and pouring boiling water over it. And lastly, taste can be a concern with most of the herbs. Thank you so much for listening, and I hope that you learned something from my discussion today. And I just wanted to emphasize that herbal medicines can still have dangerous side effects. So for worst case scenarios, please consult your doctor right away to avoid complications. Thank you and have a good day.
Hello, my name is Castel Bianca Villasaran, and I am to report CLO number 6. And it is to enumerate the indications and preparations of the 10 medicinal plants endorsed by the Department of Health. So the first plant we have here is the Lagundi or the Vitex negundo. As children, we were medicated with this herbal plant through Ascoff cough syrup, and we all know that it relieves our cough as we have experienced. So the indications for this herbal plant would be cold and flu, asthma and cough, fever, dysentery, colds and pain, but it is most likely to relieve cough. So preparations for this herbal plant would be in a form of a topical paste, Lagundi decoction and tea, Lagundi oil, Lagundi capsules, tablets, and syrups. An example would be the Ascoff cough syrup. So the next herbal plant is the Olasimang bato or the Peperomia pellucida. Olasimang bato is used for the treatment of hyperuricemia and for gout relief. So its indication would be hyperuricemia and gout. It is prepared by having it as a tea or eaten raw. The next plant we have is the bawang or the Allium sativum, and as we all know, it is the garlic. The garlic is indicated to relieve hypertension, toothache, and high cholesterol levels in the blood. Here's how bawang is prepared. For toothache, you pound 1 clove of garlic and apply to the affected part. And for hypertension, fried, roasted, or soaked in vinegar or blanched in water. And take 2 to 3 pieces 3 times a day. So we have here the next plant, which is the bayabas or Psyllium guajava, and it is used as an antiseptic. It washes wounds and relieves diarrhea and toothache too. It is indicated to washing wounds, toothache, and diarrhea. It is prepared by warm decoction, and for toothache, use freshly pounded leaves and apply to the affected part. And we have the next herbal plant, which is the yerba buena or the Mentha cordifelia. Yerba buena is used to treat pain from rheumatism, headache, and arthritis, and others. That's why it is indicated for pain, rheumatism, arthritis, headache, swollen gums, toothache, menstrual and gas pain, nausea, and fainting. Here's how it's prepared. For pain, you have to boil chopped leaves and strain it and drink it. For rheumatism, crush fresh leaves and squeeze the sap. Massage the sap on the affected parts along with eucalyptus. For toothache, you have to cut fresh plant and squeeze the sap. Soak small cotton and apply this in the affected area. So the next plant we have here would be the sambong or the Blumea balsamifera. It is indicated for kidney stones or any kidney diseases. That's why it is a diuretic plant. Its preparation would be in the form of decoction or tea. Now we have here Acapulco or the Cassia alata plant. It is a antifungal. It treats the tinea flava, ringworm, athlete's foot, and scabies or any other fungal infections. That is its indications. Now, the way to prepare it is to freshly pound the Acapulco leaves and use it as a soap for the affected part or as an ointment. Just like an example here below, that's an Acapulco ointment. The next plant would be the niyog-niyogan or the Chrysalis indica. It is an antihelminthic plant which is used to expel parasitic worms. That's why it's indicated for ascariasis or any other parasitic worms. It is prepared by eating it raw 2 hours before the last meal of the day. And please take note that children below 4 years old can take the seeds or can take this plant. We have here the Chaang Gubat or the Carmona retusa, and it is used for the treatment for skin diseases and stomach problems. Its indications would be diarrhea and stomach ache. The way to prepare it is in the form of tea, just like in the picture below, or the Carmona retusa decoction or tea. The last herbal medicine we have here is the ampalaya or the Mamordica charantia. It is for lowering the blood sugar levels. Its indication would be high blood sugar levels, diabetes mellitus. The way to prepare it would be in the form of tea or capsules, just like here below. Just like the pictures here below. Now here is a summary for all of the medicinal plants as endorsed by the DOH based on NIR-PROMP studies. Since in CLO6, we were tasked to enumerate the 10 medicinal plants endorsed by DOH. Now we have here CLO number 7, which is to cite other herbal plants utilized in other countries as approved by their health agencies. Now, the first plant we have here is the aloe vera. It is a widely known plant that is used for treating burns, especially when we get sunburn from going out in the beach or getting burned from cooking and etc. It is an approved herbal medicine of several health administrations outside the Philippines. Aloe vera is approved by a regulatory agency in Germany, which is the Commission E, for treating constipation. Aloe vera is also known to treat wounds from second-degree burns. Another example would be the dong quai or the Angelica sinensis. It is a female ginseng taken for menopausal symptoms, menstrual cycle conditions like migraines and the like. This is a Chinese medicine. It is to enrich blood, promote circulation, and modulation of the immune system. Now we have the capsicum annum, or known as the chili, but here we have cayenne pepper. It is commonly used for an upset stomach, toothache, poor circulation, fever, hyperlipidemia, and heart disease prevention. Capsicum annum has a high dietary fiber. That's why it is used for stomach problems. And the last herbal plant we have as an example would be the eucalyptus. It is used to treat a variety of diseases or conditions involving nasal congestion, asthma, and a tick repellent. It can also be used as a remedy for several skin conditions like arthritis and skin ulcers.
Hello, I am Mr. Bastaso Matthew, and I will be discussing CLO 8, 9, and 10. For CLO 8, we will discuss the contraindications in the use of herbal preparation. The first are people taking other medications. This is because some pharmacological medications may interfere with the herbal meds and produce adverse effects. Next, we have people with serious health conditions such as liver or kidney disease. This is because chemicals and substances in herbal medications may not be metabolized and excreted properly if the patient has liver or kidney diseases. Third, we have people who are going to have surgery. The reason for this is because some herbal medicines might interfere with anesthesia and other medicines before, during, and after the surgical procedure. Next, we have pregnant and breastfeeding women. They cannot take herbal meds because chemicals and substances in herbal meds may have adverse effects on the fetus or the infant. If a patient is younger than 18 and older than 65, he or she cannot take herbal meds because few herbal medications have established safe doses for children, and older adults may metabolize the medications differently. For CLO 9, we will explain the scientific principles involved in preparing and administering herbal medicines. First, we have microbiology. The nurse must perform hand washing and rinse the herbs in order to remove microorganisms and prevent their transmission. Next, we have chemistry. The nurse must be aware of the chemical makeup of the herbs in order to determine if it is appropriate to give to the patient. Next, we have time and energy. The nurse must be aware of the correct procedure in order to execute herbal preparation effectively and efficiently. Next, we have mathematics. The nurse must be aware of the proper ratios of herb to water in order to avoid over or underdosing. Then, we have sociology. Building rapport with the patient will make it more likely that he or she will drink the medication as trust is developed. The nurse must also try to convince the patient to drink the medication should they refuse or be reluctant. Next, we have pharmacology. The nurse must be aware of certain medications that may produce adverse effects should they be taken with herbal medication. And finally, we have anatomy and physiology. The nurse should be aware of specific organs and organ systems that will be affected or will interact with the herbal medication. CLO number 10. State the guidelines in herbal preparation. First, we have use appropriate materials and equipment. Next, we have perform medical hand washing. Then, We have wash herbs, use appropriate amount of water, use the appropriate amount of herbs, strain the herbs using a cheesecloth, and optionally, you can add honey or sugar to the decoction, infusion, etc. to improve taste.
Hello, good day. I am Ms. Rodrigo, and I'm going to report CLO 11, or the nursing responsibilities in administering herbal medications. Nursing responsibilities in decoction. First is we have, for a mild decoction in a cooking pot, put leaves and 2 glasses of water. Bring to a boil over a low flame. For a strong decoction, boil leaves into 2 glasses of water over a low flame until 1 glass of water remains. That is approximately 15 minutes of boiling. Do not cover the pot to release the toxic substances in the herbs while boiling. This is because different intensity of the tea also requires different levels of flame. Not covering the pot releases toxic substances in the herb while boiling. Second is we also have strain the decoction using a cheesecloth. This helps remove any pieces of herbs present. Third is we also have let the decoction cool before drinking. If preferred, add sugar, honey, or fresh fruit juice to improve the flavor. This is to avoid yourself from burning the tongue, and by adding sugar, honey, or fresh juice to help improve the flavor. Next is we have during. Fourth, drink 1/4 of the tea every 3 hours during the next 12 hours. This is by drinking the preparation on every interval, it helps to ensure the effectivity. Fifth is we also have repeat procedures 1 to 4 for 3 days. Remember to discard the leftover solution after 24 hours. It will lose its taste because of vigor and strength, and that time bacteria will grow. 6 is we have observe any improvement and continue for 2 to 3 weeks or more. This is to make sure the effectivity of the tea. Then after is 7th, if no improvement appears, consult a physician. If there isn't any improvement, the herbal preparation is not effective or working. Consulting a physician is to ensure proper medication and diagnosis. Lastly, we also do aftercare. It is to prevent any microorganisms and keep your area clean. Nursing responsibilities in hot infusion. Place 1 heaping teaspoon of dried chopped herbs in an empty glass. Dried herbs are more concentrated and potent. Second is we have pour boiling water into the glass until almost filled. It is important to add as much water because it reduces the concentration. Then we have during. Stir the mixture very well. Stirring the mixture helps it to be widely distributed with the hot water. Then fourth, cover the glass and let it stand for 15 minutes. It is to make sure that the herbs we infuse with the hot water and maximizes the nutritional value. Letting it stay for 15 minutes is to make sure the mixture cools down. Then we have after. Fifth is strain. It helps remove any pieces of herbs present. Sixth is we add sugar or honey if preferred. It helps to improve the flavor of the herbal preparation. Nursing responsibilities in cold infusion. First is we wash the herbs. Washing helps improve the dirt or any microorganism present on the herbs. Second is we chop or crush the herbs. By chopping, it extracts the essence of the herb. Then during, we have place 3 heaping teaspoons or 1 handful of chopped herbs in an empty glass. Using cold water helps not destroy the medicinal properties of the fresh herbs. We have fourth, pour tap water until it is almost filled. It is to soak the fresh herbs. Fifth, cover the cup for 1 to 2 hours. This is to make sure that the fresh herbs is infused well with the cold water. Then we have after, we strain the solutions. It removes any pieces of herbs. Then lastly, we add sugar or honey if desired. It helps improve the flavor of the herbal preparation. Nursing responsibilities in aromatic bath. Before, first, mix the leaves and water in a cooking pot. By soaking the leaves with water, it is for easier mixing and ready for boiling. Then we have during, is we have to bring to a boil and remove from the fire. It is to extract the juice from the leaves and have it mixed with water. Then third, when the mixture is already lukewarm, remove the leaves. Removing the leaves helps for the facilitation of the aromatic bath. Then we have after, take a bath with the remaining solution. It is to promote healing. Nursing responsibilities in policies. Before, explain the procedure to the client. Explaining to the patient is to build rapport and gain the trust of the client. It is to reduce their anxiety to have a smooth flow of the procedure. Second is do medical hand washing. It prevents the spread of microorganisms. Third, we have prepare the necessary materials needed. It helps save time and energy and promotes efficiency of the nurse. Next, we have during. Cut the fresh leaves. By cutting the leaves, it is easier and faster to pound. Fifth, soften the leaves by pounding it, using the mortar and pestle. It is to extract the juice from the leaves. Sixth, continue pounding until the juice comes out and set aside. It is to make sure that the adequate amount is extracted. 7. Mix the cassava flour with hot water to form a paste. It helps create an attachment for it to stick. 8. Spread the cassava flour on sterile gauze. This is to facilitate the incorporation of the pounded leaves. Then 9th, we have incorporate the pounded leaves to the gauze with cassava flour. It is to ensure that the leaves pounded will stick and ready to be applied in the affected area. Then we have after. Apply the warm and moist preparation directly to the affected cut. 10. Apply cut. Then we have after. 10. Apply the warm cut. Then we have after. Apply the warm and moist preparation directly to the affected part. It is to promote healing in cut. Then we have after. Apply the warm and moist preparation directly to the affected part. It is to promote healing directly in the affected area. Then lastly, we do aftercare. It maintains cleanliness and orderliness. So for more video references, you can check out the ones posted. So thank you and stay safe, guys.